I'll forgive you, but you tremendously abuse the science. You're wrong. Please don't repeat it. Please don't show your ignorance.
So you're saying it's not true.
But, perpetuating stupidity of others is not a game I play.
We can get all of the nutrients that we need from animal products, and the same can't be said from plant products.
The reasons why a plant-based diet are healthful are very much supported by basic science. A all-meat diet may not be healthful long-term for cardiovascular health, and GI cancer risk are very much supported by basic science. We better be very cautious with heart patients when we're talking about meat-heavy diets.
Yeah, so I'm glad you brought up that abomination of a headline that came out of the American Heart Association. It has not been reviewed, and it was a patient who already had heart disease, and that's just emblematic of the bias that goes on in our literature. A nutrient-dense food that we have been eating for millions of years as human beings somehow only apparently started causing heart disease in the past 100 years really makes no sense.
Are statins beneficial, and why? Does high cholesterol cause heart disease? What role does refined sugar have on heart health? Do you believe that seed oils are causing inflammation? It sounds like the obvious truth is... All right. Well, I think without any further ado, let's get into this. So very, very excited to have you guys both on today. Thank you so much for taking the time. Today, I'm going to let you guys speak to your expertise, of course, but Dr. Ovadia, you are a cardiologist who it seems like you have a lot of belief that there's a lot of different ways one could live their lifestyle to have a healthy lifestyle, avoid disease and heart issues, but you are somewhat of a proponent of the animal-based lifestyle. But I'll let you get into that in a second here. And Dr. Kahn, you have been vegan for the last, I want to say it's 27 years
40,
or so,
40,
close to 30.
47.
47 years, okay. And long time. And you are also a cardiologist. You promote more of a plant-based lifestyle for one to have a healthy heart, healthy body, healthy mind, all of that. So the point of this conversation today is really to have a conversation. You guys are both experts in the field. You guys both, your missions are to help people. Heart disease is one of the leading causes of death in the United States. You guys know that better than anybody. And really, we are trying to understand truth based in fact and not, have sides necessarily. I think there's a lot of picking sides out there. So I'm not interested in that. I think bringing the two best people on to have a conversation is what we need to run with fact. So really, that's what I'm looking for. The way this is going to go is we're going to have about 6 questions. Each question, I'll pose to you both, and then each of you get 2 minutes or so. It's going to be exactly 2 minutes, really, to state your point, and then after that, we'll get 5 minutes to have a conversation back and forth. I am going to be pretty strict on cutting you guys off, so if I cut you off, it's just because time's up. But would love for you guys to, be as direct and informative with the information that you have as you possibly can, because that's all what we're looking for here is just understanding to help people out. So does that make sense? Do you guys have any questions on that?
Good.
Let me do this really quick. If you guys wouldn't mind, Dr. Kahn, give a quick, 1 minute of who you are and why you are worthy of having this conversation for everybody listening.
Sure. My name is Joel Kahn. I'm a medical doctor. I'm a fellow of the American College of Cardiology. I'm a clinical professor of medicine at Wayne State University School of Medicine. I've been graduated summa cum laude from University of Michigan School of Medicine. I have been taking care of patients for about 35 years. Right now it's an all preventive practice, but I used to be pretty internationally known in the field of interventional cardiology, heart attack treatment, and stents. I personally have been plant-based for nearly 47 years, so I have a lot of experience personally in counseling patients. And I have a calcium score of 0 and absolutely no plaque in my coronary arteries on CT angiography, which is a pretty good statement in and of itself. But I'm talking about a much broader body of data than a personal statement. But that's it.
Awesome. Okay. And Dr. Ovadia, what about you?
Sure thing. So I am a cardiac surgeon, have been in practice for 20 years, and I was a very unhealthy heart surgeon. I was morbidly obese. I was pre-diabetic, and I ultimately had to figure out for myself why that was. And ultimately came across a low carbohydrate approach, which then evolved into a carnivore approach now for the past 4 years or so. I also have a coronary artery calcium score of 0, although admittedly I'm a few years younger than Dr. Kahn, but that is in the context of a strong family history of heart disease and siblings who both have non-zero scores, so I think I might be doing something right. And I have increasingly been focused on keeping people off my operating table and helping people to understand how they can avoid the need for heart surgery.
Yeah, that's fantastic. You guys are both, Dr. Kahn, I knew about you years ago when I heard you on Joe Rogan.
There you go.
That was great.
Thank
Yep. And I heard you, Dr. Ovadia, on Diary of a CEO. So both of you guys have been, causing ripples out there and helping quite a lot of people improve their health. So with that said, let's go into the first question. And the first question, I was getting into, is for you, Dr. Kahn. This will be 2 minutes. I'll start the timer after I state this, but then we'll go to you, Dr. Ovadia. Does high cholesterol cause heart disease? And if so, why?
High cholesterol, specifically LDL cholesterol, is undoubtedly a cause of heart disease, not the cause of heart disease. There'll always be examples of people with high LDL cholesterol that don't have detectable atherosclerosis. There'll be examples of people with low LDL cholesterol that have atherosclerosis, because there are about 25 major factors that cause atherosclerosis. But LDL cholesterol is the one absolutely necessary risk factor to develop atherosclerosis, because it's what's found in the plaques, either plain LDL or oxidized LDL. There are multiple what are called Mendelian randomization studies. I'm the author of one of them in 2012, that if you're born with a lower LDL cholesterol than average, you will have a dramatically lower risk of coronary disease. And if you're born with a higher LDL by genetic basis than average, you will have a dramatically higher level. And there's also what's called homozygous familial hyperlipidemia. And my patient when I was a fellow, Stormy Jones, these kids that have bypass surgery, stents, heart attacks, and die at age 10, 11, 12 because their cholesterol's 900 or 1100. They're proof pudding that with no other abnormality, a high LDL can cause disease. So it's complete nonsense that about 2% of doctors say LDL cholesterol doesn't matter, but it's complete and utter bullshit.
I'm going to ask you the same question, Dr. Ovadia. Does high cholesterol cause heart disease, and why?
Yeah, so I would tell you that high cholesterol is not causative of heart disease. It may be a contributing factor. And, I agree with Dr. Kahn that it's one of many factors. And I would say that its importance as a risk factor has been largely overstated. And that doesn't mean that we can ignore it. And I would also say that there is a lot more nuance. We have been focused on the amount of cholesterol as the risk factor, and I would put forward that it's more the quality of the cholesterol and the environment that the cholesterol is in that makes it a risk factor. There are people, as Dr. Kahn said, who have high cholesterol and they never develop heart disease. And I want to know why that is. I'm curious as to how some people have high cholesterol and never develop heart disease, and some people have low cholesterol and do develop heart disease. And that just tells me that cholesterol is an incomplete explanation for the heart disease problem. And despite our focus on cholesterol for the past 50 years, heart disease isn't going away. So we need to do a better job at looking at what some of those other risk factors are and what makes cholesterol in some situations a risk factor, but in other situations it's not. And that's what I'm really curious about and what, I am trying to do a better job of figuring out with my patients.
Okay, fantastic. So, it's really interesting because it sounds like there's some potential similarities here, some obvious differences. I've been curious a lot about cholesterol's role as well. My mother passed away from heart disease amongst other things as well in her life. It was a big factor. What is it what else in addition do you guys think could be going on here with cholesterol? What is it, and we'll do this for 5.
I'll jump in and stay under 2 minutes. I mean, clearly we've known for 150 years that inflammation found pathologically is a major part of the pathophysiology of coronary artery disease, stroke, acute myocardial infarction, peripheral arterial disease, aneurysms. We weren't really good at measuring it, and I don't know that we're still excellent, but we have a pretty good array of lab tests from high sensitivity C-reactive protein and myeloperoxidase to LPPLA2 and others, oxidized LDL. We do a really bad job. Take your mother for an example. And they measure her cholesterol in a clinic, but they don't measure inflammation. And it seems it's debatable. There was actually a study this week called the CLEAR study published at the American Heart Association that actually suggested that the inflammatory markers were slightly more important than the lipid markers. Other studies sway the other way, that the lipid markers are somewhat more important than the inflammatory markers. But we can't keep these lines so black and white. They're blurred. They're both important. And really the message is to the patients listening, ask your doctor for an extensive inflammation panel. And for the practitioners listening, be sure you're ordering extensive inflammation panels because it is a combination of both. Plus, as I say, easily 20 other factors, and most of them are measurable in the blood. So that is the complexity, like Dr. Ovadia said, of taking one patient and trying to figure out why they do or don't have atherosclerosis. You got to do very comprehensive lab work, and you might uncover homocysteine, you might uncover lipoprotein A, you might uncover genetic factors, ApoE4. So it takes a lot of blood work. It costs a lot of money, but it's fun to track down and try and help people when you have the whole database.
Sure. And Dr. Ovadia, go ahead and we've got 5 minutes, so go ahead and respond to that.
Yeah, so first and foremost, I agree with everything that Dr. Kahn said, and I think inflammation is very important. And the only little, nuance that I would maybe change about what he said about the recent, study that came out of the CLEAR study last week was it really showed that inflammation was a much more significant risk factor, and LDL in that study had really no predictive value in heart disease, which doesn't, again, like I said in the first question, it doesn't mean that LDL is meaningless. It just means that we need to recognize its importance. The one factor that I would certainly add, and I would say that Dr. Kahn didn't mention it because of time, not that he doesn't know about it, is insulin resistance. And in study after study, the seminal work going back to Dr. Reven in the 1970s and 1980s, insulin resistance is clearly a major risk factor for the development of heart disease, much higher magnitude of risk factor than LDL cholesterol is in every study that I have looked at that compared the two. So again, I think that LDL as our main focus has been a distraction and has really done a disservice to our patients because most doctors, unfortunately, only focus on LDL, like Dr. Kahn said, and that is clearly not good enough. And we need to be checking these inflammation markers. We need to be checking for insulin resistance. We need to be checking for lipoprotein A and homocysteine, and getting more, and then making the changes that are going to influence these metrics. And unfortunately, for a lot of these metrics, like insulin resistance and inflammation, it's not as simple as prescribing a pill. It really comes down to diet, lifestyle, interventions, and that's where I think the most power lies. And I think doctors, quite frankly, need to wake up and no longer be willing to just be pharmaceutical dealers. And we need to be thinking about these root cause issues and these diet and lifestyle changes that we can help patients to implement to really have meaningful impact on their health.
Yeah, absolutely. I think both, it's fascinating because both of you guys are saying similar, LDL. Well, Dr. Kahn, it sounds like you're saying that the emphasis is certainly on cholesterol, but certainly not alone, right? Definitely not alone. It's a factor, but it's not the only thing that's contributing.
I was going to say, I'm the farthest, and probably, again, similar to Dr. Ovadia, farthest from a pill pusher amongst most of my peers. But when you take a drug class like statins, controversial, controversial on the web. They're not controversial in universities. They're not controversial in most cardiology practices. And most of them are generic and they're very cheap, so it's not a financial thing anymore. There are a lot of expensive cardiology drugs now. We're catching up to oncology, but generic statins are not a financial gain for anybody. But they are pretty good anti-inflammatory agents, and they're very good LDL cholesterol lowering agents. They're really bad at lowering lipoprotein little a, which hopefully we'll talk about a little bit, as a single molecule that 20 to 25% of people inherit. That's pro-inflammatory and pro-atherosclerotic and pro-thrombotic. So it's like the most awful of all combinations you can have, and statins are worthless for lipoprotein little a. But if you just go back to statins, they cover a few of the bases. They do lower the C-reactive protein pretty dramatically. They certainly lower LDL cholesterol, depending on.
So, and then let me cut you off there too, really quick, because the next question was, are statins beneficial?
Right.
And why? So why don't you kick us off in that, please?
So, and I think there's going to be a lot of agreement in at least the style of our practice. I practice, and I think it's fair to call it personalized cardiology. You're different than the next patient and the one before, and I have to work hard to characterize you. So I became aware back in 2007. I've been a big advocate for 25 years of coronary artery calcium screening at age 45, 48, 42, something like a colonoscopy or a mammogram to identify heart disease in an early silent stage. And it used to be an expensive test. Now it's $50 to $100, and the radiation dose is extremely low. But in 2007, a group formed called SHAPE, Society of Heart Attack Prevention and Eradication. I was not in it, but I read it. And they suggested before you pull out your prescription for Lipitor or Crestor in a otherwise healthy person with a high cholesterol, get a calcium score or get a carotid ultrasound. If they don't have plaque, why are you prescribing a prescription drug for life? Use lifestyle, whatever lifestyle. Dr. Ovadia's lifestyle, my lifestyle, exercise, sleep, weight loss. Give them a chance. You don't have to go to a drug. That subsequently has been endorsed, that a person with a calcium score of 0 before you get on drugs for life, if you're a 0. The American Heart Association says the same thing now since 2019. So I stopped statins in a lot of people. I reduced the dose in a lot of people, and I won't use them in a lot of people because I've identified that they're like Dr. Ovadia and me. We both have calcium scores of 0. We're the two least likely people to ever benefit. Maybe you treat 1,000 people to help one if you've got the heart health that the two cardiovascular specialists have here on this conversation. But you take somebody that's not doing well with lifestyle change, there's a lot of people, you can take the horse to water, but you can't always get them to drink water. They're drinking bulletproof coffee, and or their numbers are crazy. Their cholesterol's 400, and it's not going to respond that well to lifestyle alone and all. I mean, statins properly used. I'm a big fan of a combination of statins with ezetimibe. You get to use much less statin, and you get a really nice response. With the synergistic effect of two drugs at very low doses. There's a recent series of studies in Korea.
Sorry, I have to cut you off there for 2 minutes.
We use these combination cholesterol approaches when we use cholesterol drugs.
Okay, cool. And we can come back to that. Just first, Dr. Ovadia, what's your stance on this, specifically with statins? Are they beneficial and why?
Yeah, well, I think the benefits of statins have been very much overstated. And I think yes, there are some people that benefit from taking statins. And, like Dr. Kahn said, if you have inflammation and you have insulin resistance and you have high cholesterol and you're not going to make the dietary and lifestyle changes that are going to lower your inflammation and eliminate your insulin resistance, then there's going to be some benefit to taking medication to lower your cholesterol. But those benefits are very much overstated. And, the large relative risk reduction numbers that get thrown around very much, inflate their benefit. And the absolute risk reduction numbers, tell a much different story, that we see, in the best trials, absolute risk reductions on the order of 4 to 5%. In secondary prevention, by the way, people who have already had an event. In primary prevention, those numbers look more like 1 to 2%. So I think we are, misleading our patients when we give the impression that just take the statin and everything's going to be fine. Because the reality is that statins have very little benefits. And, those benefits probably come more from the anti-inflammatory effects than from the cholesterol lowering effects. And, some of the studies support that. That is my take on statins and, on cholesterol lowering in general. And again, I come back to the question of, do we really need to lower this patient's cholesterol? And I very much agree with what Dr. Kahn said. This is a personalized thing. It's not something that we can make a blanket recommendation on. And so having guidelines that sort of force doctors into doing this so that they're compliant and practicing, good medicine, I think is the wrong approach. It's an individualized, it's a nuanced decision. It's way more complex than just looking at your basic lipid panel, as we've both been saying. And you need to treat that patient in front of you. And we need to recognize that, yes, there are going to be some patients that having a elevated, even very elevated cholesterol level is not problematic for that person.
Okay.
And so lowering.
And I have to cut you off there as well. Sorry, I don't mean to cut you off. Both of you, though, continue that. We're just now opening up. Continue with what you were saying. This is a full, keep going with what you were saying there.
Yeah, and I guess I'd love to hear, Dr. Kahn's thought on, are there patients in which an elevated cholesterol level is not problematic? And how do we figure out which patients those are?
Yeah, I think arguably that if a person will go through a coronary artery calcium score and come back 0 or very close to 0, I'd prefer 0. And that's 40 to 50% of the population. So that's a lot of people. If I prefer to also do, if it's available, a carotid intimal medial thickness ultrasound, just to look at another vessel with another technique. There's no erectile dysfunction and other factors. I'm very tolerant that they don't need a super low cholesterol. I mean, I'm not on a statin, and my cholesterol runs 205, 195. I have most of my serious heart patients much lower than that, but I'm tolerant of my own health because I monitor it pretty closely. We share a patient we just learned before we went on who runs a cholesterol, over 450. That's a little bit more controversial. Let's not go too deep into her, but people won't know who it is. But, she has some coronary calcification and some carotid plaque and some completely wacko inflammatory markers. That obviously 99% of cardiologists would say it's insanity. But, I actually told her I'm willing to watch you over time. I don't agree with what you're doing, but I think we can, head off the stroke and the heart attack if we keep a close eye on you, a few simple measures. So I think we can personalize and tailor. I haven't followed this completely, but you're probably aware of an online, I'll call him a lipid researcher, Dave Feldman, mainly posts on Twitter. And there's another cardiologist who's world famous for lipoprotein A, Dr. Sam Tsimikas, and they're actually planning some kind of low carb, lean muscle mass, high responder, hyper responder study, because there's a whole new world now. We should talk about coronary CT angiography. But, now we have the ability to look at some of these wacko approaches and actually look at coronary plaque development, coronary plaque regression, and maybe, be more precise in our patient care.
Yeah, and full disclosure, I'm I would say good friends with Dave and follow what he's doing closely. Yeah. And I think his study is going to help inform us. He has one study already underway. Him and Matt Budoff, who's one of the premier radiologists, and leaders in the CT angiography. Yeah, in the CT angiography field. And so they're doing the study where they're looking at these people with exceedingly high LDL cholesterol levels. Entry criteria, I believe, were over, you had to have an LDL over 300 for at least 3 years. And doing CT angiograms 1 year apart, and I think it's going to be very informative. And I agree with you. I think the CT angiogram is a great tool that we have available to be able to monitor patients and determine if all of the various factors in their life are problematic or not. Are they accumulating plaque or not? And so I fully agree. And, we even now have we can do plaque scoring. We can go beyond just soft and calcified plaque. The clearly AI, sort of guided scans now can tell us, we're starting to figure out more detailed characteristics of the plaque to know whether these are unstable, problematic plaques or these are stable plaques that we don't have to be as worried about. So I'm very optimistic about that future and that we are getting to the factors. In the end, the blood factors, the blood markers, may not even be the right answer. They're looking at indirect predictors when we can look directly at the plaque today. So I agree with you. That's something that we should be doing more of.
It's interesting to me to listen to this, but it brings up a question to me of what a lot of people who are in, let's say they're looking towards an animal-based or carnivore lifestyle to fix their health problems. They have a lot of suspicion about, processed sugars and how much processed foods might be causing the problem. And even just sugars in general, right? Which often comes from, plants, comes from fruit, plant-based lifestyle. And so it's because a lot of people believe that the way humans evolved was maybe having some fruit, having some plants, maybe, but like more seasonally rather than consistently all the time, because, to process that in the liver it could cause a lot of problems because of the sugar. So what I'm curious about is for this next question is and we'll start with you, Dr. Ovadia. What role does refined sugar have on heart health? And do you think this is overlooked? And then I'll add to that, do you think that this is in part why a carnivore lifestyle has benefited the patients that you work with? Because it's removing a lot of that. So we'll go ahead and start there.
Yeah, so I think refined sugars are one of the components of processed food that is problematic. And, I would also I would broaden that to be refined carbohydrates, and I would add in industrial seed oils as problematic components of processed food. Ultimately, it is clear that processed food is a major problem, and I would say the major problem. And, whether you're vegan or carnivore, I think we can agree that eliminating processed food is going to be a majorly beneficial step for your health. If you are taking the plant-based approach, you have to be careful that you're not relying on overly processed plant-based foods is the way that I counsel my patients. The carnivore diet and animal protein focused diet, I think, is an ideal approach. I think we can get all of the nutrients that we need from animal products, and the same can't be said from plant products. Vegans do need to supplement, and I view that as problematic, but I'm willing to work with people on it. And ultimately, elimination of refined sugar, refined carbohydrates, industrialized seed oils, and processed food in general, I think is the approach that's going to get people to their best health.
Okay, fantastic. And Dr. Kahn, same question to you. What role does refined sugar have on heart health, and is this overlooked? And then I'd love to go into, what your perspective is on what Dr. Ovadia just shared there. So go ahead.
Yeah, refined sugar has been a target of research for 70 years, along with saturated fat. The rise in heart attacks after World War II prompted a lot of research. And those two nutrient groups, saturated fat and sugar, became a war zone. I'm a bit of a historian about Ancel Keys, and probably disagree with Dr. Ovadia there, but I've written his biography and I know his family members and I've read his papers. And, Dr. Keys said the second most important nutrient ingredient in cardiovascular disease is added sugar, but number one is saturated fat. And he had plenty of data and prospective studies. And subsequently, we know both are very important, but statistically, by our values, saturated fat correlated with heart disease development more than sugar, but they both were statistically significant. And it created a war, and it just led to all kinds of confusion that's unnecessary. So yes, there's no doubt now that there's many current studies with the obesity and overweight craze throughout the Western world that added sugar correlates well with insulin resistance, correlates well with obesity, correlates well with heart disease, and should be, drastically reduced or eliminated. Very different than talking about fruit. Fruit has very good data, a 7-year study in 500,000 people by an author named Du, that the more fruit you eat, the lower is your risk of diabetes, because it's a very different product. It's also what is added sugar in. Is it in a donut? Is it in a cookie? So it comes with all the other crap. I'm not a fan of table sugar either, but it's the company that added sugar keeps is half the problem also. Where with fruit, the company that the natural sugar in fruit keeps is called fiber. It's called water. It's called nutrients and vitamins. So it's good stuff.
Okay, nice. You got it right at 2 minutes. So I'd love to hop into kind of what we were just talking about with actually Ancel Keys. That's very interesting, but also what your perspective is on this carnivore lifestyle, with what Dr. Ovadia was just talking about as the ideal.
Well, the only problem there is he's required to be a scientist and a clinician. I'm required to be a scientist and a clinician. And we mentioned a study that's about to embark that will change the history because it's going to be the first authentic study of the carnivore diet. There's no other, there's none. You can go to National Library of Medicine. It's all anecdotal and it's all personal reports. And I've been on national TV. I was on the doctor show debating Dr. Paul Saladino. He brought two ladies that felt better they ate 2,500 calories of meat at 4 to 6 p.m. and they felt better and their acne improved. And I told them, it's wonderful, but that's not how doctors make decisions for broad populations. We do science, and the science to support a plant-forward diet, from the Mediterranean diet to a full vegan diet, is about 99.9 times larger than the science. I mean, I literally yesterday had 5 minutes free between patients. And I went to National Library of Medicine, I put in Healthy Plant Diet Index. And I came up just in the last 12 months with 15 huge systematic reviews, plant-based diets and lower risk of depression and dementia and osteoporosis and cardiovascular disease and metabolic syndrome and insulin resistance and GI cancers and on and on. I mean, literally, I put them all on Twitter, just like boom, 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 boom. And I mean, it literally took me 5 minutes. You could spend 15 hours. You can't find that kind of data with the carnivore diet or ketogenic diet. So, right now, I'm a big fan of Dr. Walter Longo and professor, University of Southern California. He's got something called the 5 Pillars of Nutritional Science for Longevity. And epidemiology is one of the pillars. It's not a great pillar, but it's the one that dominates the science. Then you got randomized studies and basic science. The reasons why a plant-based diet are healthful are very much supported by basic science. And the reasons why a all-meat diet may not be helpful long-term for cardiovascular health are very much, and GI cancer risk, are very much supported by basic science. So I don't agree that the carnivore diet is perfect. It's worked for some, but since there hasn't been a study yet in cardiovascular disease, not one, not a case report, all we have is ketogenic diets causing rapid acceleration of coronary artery disease, and that's a close cousin of the carnivore diet that was just reported at the American Heart Association last week. We better be very cautious with heart patients when we're talking about meat-heavy diets.
Yeah, so I'm glad you brought up that abomination of a headline that came out of the American Heart Association. That abstract, which has not been reviewed, and it was a patient who already had heart disease and then developed recurrent heart disease. And somehow this is being blamed on the ketogenic diet, which they had been doing for a short period of time. And that's just emblematic of the bias that goes on in our literature. And what I would push back on the saturated fat front is we now have multiple meta-analyses that show that saturated fat is not a significant risk factor for heart disease. We have, studies like just one that I pulled out, the title being Total Meat Intake is Associated with Life Expectancy, the cross-sectional data of 175 contemporary populations showing a linear relationship between the amount of...
Not the pure study. Yeah.
No, not the pure
not
study.
The pure study.
Not the pure study. And, again, we just have a lot of faulty science that has now been amplified many, many times. I just would push back that saturated fat and red meat intake, non-processed red meat intake, is not a risk factor for cardiovascular disease. It never has been, and it never will be, no matter how many times the same scientists, repeat these same, studies. So that would be where I push back. And then, I would just, again, I think there's a lot that we agree on. And I think that we can agree that processed food, with high sugar contents, highly refined carbohydrates, and vegetable and seed oils, plant oils, seed oils, I should say specifically, because I agree with you. Olive oil, no problem. Coconut oil, no problem. Fruit oils are fine, but these industrialized seed oils are clearly problematic. And, rather than focusing on a nutrient-dense food that we have been eating for millions of years as human beings, and somehow only apparently started causing heart disease in the past 100 years, really makes no sense. And again, I think it has been a huge disservice to the population to put the message out that red meat has been harmful to our health. And the last thing that I'll add is I agree with you. I'd love to see the large studies done on a carnivore diet. I'm all for it. Let's study it. Let's get the data out there. Unfortunately, the scientific community doesn't have an interest in doing the studies, and they don't get done because they don't have some of these industrial forces behind them that the plant-based community does. And plant-based diets, I don't disagree with you. They are a huge improvement over the standard Western diet. And that's what all the studies have shown. But they've never been compared head-to-head with a animal-based diet. They've only been compared with Western heavy processed food diets. And so, yes, they're an improvement over that.
Kind of begs the next question. This is what I was going to go toward. Dr. Kahn, do you believe that seed oils are causing inflammation issues for people?
No, I actually don't think they are. I think they've been maligned. I refer anybody, I hate to refer to a lay publication, but Consumer Report, May of 2022, had a great article called Do Seed Oils Make You Sick? And the major person interviewed was the head of nutrition science at Tufts University, who Dariush Mozaffarian, who many people consider, probably the top 5 nutrition scientists in the country, maybe the world. And, it's the same thing with added sugar, trying to sort out, is canola oil dangerous, or is the cookie and the cake that's baked with canola oil and sugar and white flour and put some other ingredients in there, some preservatives and BHT, sort that out and isolate it from the seed oil. When you isolate seed oils in scientific studies, the classic study, which all cardiologists learn about, is the Leon Heart Trial. The Leon Heart Trial was in the I want to say 1970s, but maybe it's the 1990s. I apologize. I don't know their reference open, but it's just such a dominant trial. It was only about 750 patients with heart disease who were using butter, and they replaced their butter with canola oil. And the dramatic reduction in the group on canola oil. It's not my favorite oil. You won't find canola oil in my house, although I would use organic canola oil. It's just it's all a GMO crop, so you're pretty much cornered into using organic canola oil if you're going to use it. You're going to find really high quality extra virgin olive oil in my house. But the data that canola oil is pro health in cardiovascular patients was dramatically exemplified in the Leon Heart trial. And then there are other studies out there. There's a very famous study that causes some of my plant-based medical colleagues to give olive oil actually a bad name. It's a side topic. It's an annoyance. It's a confusing topic. But in the study, it was olive oil used to measure flow down your arteries, flow-mediated dilatation. And the control group was canola oil. And interestingly, the flow down brachial arteries with canola oil went up, which would generally be considered a good thing, a vasodilatory effect of canola oil on arteries. I don't use that to tell my patients to consume a canola oil. They hear only one message from me consistently, extra virgin olive oil. There's so much data for it. But, again, anybody just wants to dive a little deeper that the seed oils are not toxic. I think it's the entire, hyper-processed food, fast food, frozen food, preservative food, food coloring food. But to isolate out and look at omega-6 fatty acids, it doesn't hold up.
Yeah, well, as Dr. Kahn said earlier, we need to be scientists and clinicians, and right actually above my head, Dr. Chris Kenobi, has done a masterful job of summarizing the science on seed oils in his new book, The Ancestral Diet Revolution. And, he has about 300 pages of pretty damning evidence from the scientific literature showing that seed oils are clearly associated with negative health outcomes. I would also point to a study that Dr. Kahn, I'm sure, is very familiar with as Ancel Keys' biographer, the Minnesota Coronary Experiment. And, that was probably one of the best done randomized controlled trials we have on, dietary interventions. And in that group that, they introduced, they substituted these seed oils for their saturated fat. All-cause mortality went up. I think the science does show us that seed oils are problematic. These are highly processed, industrialized oils. And the bottom line for me is that they really have no role in human health. These are things that we did not eat for the vast majority of our existence as human beings. And I would just strongly disagree with the contention that they are not harmful to our health. And I think we have voluminous evidence showing that they are harmful to our health.
Listening to this too, it's like from people who are not experts like you, right? Just wanting to understand what to do. It sounds like the obvious truth is remove processed foods. That's like the best we know. That's what we need to do. Highly processed sugars, all that stuff is terrible for us. How can we come to an agreed upon answer for things like process or for seed oils, right? Like this it's really just to get down to the fact and the science so that people can progress in their life, and make a good decision. Everybody's trying to do the right thing. Is that what that study is going to bring to us? Where we can actually study the carnivore lifestyle and compare it to a plant-based lifestyle, not just against a standard American diet or vice versa, right? What can we do to make this clear for people?
Well, I don't know. Again, I always fall back. I'm a cardiologist. And right now in 2023, soon to be 2024, the only diet ever shown to reverse atherosclerosis is a variety of studies using whole food plant-based diets, not processed diets. Maybe it works with the ketogenic diet and the carnivore diet, and maybe with the new Clearly and coronary CT angiography, it'll be a little easier to do. When Dean Ornish did it with quantitative coronary angiography, it still remains the state-of-the-art technology. It just now you don't have to do it invasive. But if we have an epidemic of cardiovascular events and we have a diet that's been shown to regress plaque, lower inflammation, drop hospital admissions and heart events by 50% in 5 years, improve angina, improve erectile function, improve claudication, heart patients should be put on a whole food plant-based diet. They're generally without seed oils anyways, so it takes, and they're generally without added sugar. They're whole food plant diets, extremely healthy diets. These research studies with Dr. Ornish, Mr. Pritikin, Dr. Esselstyn, Dr. Furman, they were lightly supplemented, vitamin B12 perhaps. I actually supplement my patients more than that in the clinic because I'm drawing so many damn blood levels. But these people improved with 5 cents of B12 a day. And I'm not even sure all of them actually got that. So I think that remains, that remains the rock that has to be challenged by any other diet. Even the Mediterranean diet, there's limited diet about plaque reversal with the Mediterranean diet. There is some interesting data from Spain with plaque reversal with a high olive oil diet called Cordioprev. That's rather intriguing and very high quality and large. So anyways, that's, my little piece I don't give up on. Show me a study that reverses plaque and decreases events and improves symptoms and improves erectile function. And, then we've got a variety of things to offer to patients. But right now, serious heart patients get whole food plant-based diets, without a question.
Dr. Ovadia, I'd ask you the same thing. What can be done to come to this solution?
Yeah, so I think that I would encourage people to take control of their health, take an active role in their health, and do something is my first what I would put out there, because the standard advice around us clearly isn't working very well. Heart disease remains far and away the number one killer, despite our focus on lowering cholesterol and despite our push towards more heavily processed food diets, low-fat diets, clearly are not the answer, because if they were the answer, we would be seeing that in the data by now. And so like I said, I don't disagree that a whole food plant-based approach is one approach that can be successful. And I think any whole food approach, including a carnivore approach, can be successful as well. And I hope to get that data. I'm certainly accumulating the patients. And yes, those are case reports, but they're worth something. And we're seeing it more and more now. And so I continue to advocate, like Dr. Kahn, for a personalized approach for figuring out what works for that patient in front of you. And, I think we need to broaden the options. And one main thing that we need to stop is the villainization of red meat. And we should acknowledge that whole real food of all sorts, meat and plants, making that the focus of your diet is what's going to be beneficial for you. And I'm excited for the work that I'm doing with my patients, the results that I'm seeing from my patients, like Dr. Kahn. And I think that's in both of our experiences are very contradictory to what we see in the mainstream medical model, pushing a low-fat diet and, LDL reduction. And that is clearly not working. And not getting the benefits that we need to be getting. And I'm not one that blames the patients for it, as we all too often do, and say, well, they're just not listening to us, or we just didn't start it early enough, and we just didn't do it hard enough. I think it's clearly not working, the low-fat approach, and I think we need to change our focus.
We have time for just one more question. I know that we're close on time here, but something that I think is important to understand the framework that we're all working within is there's a huge belief amongst people who consume an animal-based or carnivore diet, Dr. Kahn, that they feel that fundamentally a lot of the science and the data that has been out there has often been promoted by researchers who were paid off, often by the Sugar Association. And so, you look at Ancel Keys' data, and that was, whether that was intentional or unintentional, it seemed very, very cherry-picked. And you looked at you look at when cholesterol was being studied, it was simultaneously being studied with sugar. So what would is that
Right, so
a similar
you
belief?
tremendously abuse the science, and I'll forgive you, but you tremendously abuse the science. There's one example of one paper in the New England Journal of Medicine in 1965 that clearly the authors were identified as having taken some sugar industry money. Very disappointing. I think the lead author was Hegestead. He was a very well-respected guy. But it was sizable money. It equated, I think, to about $50,000 in current dollars. It was much less than that back then. And it's awful. And, maybe the paper should be retracted. I went back and read the paper. It had no influence. It was such a dense science paper. It wasn't like it was going to be a splash that, millions of people read and started eating cookies. But it's awful. Dr. Keys, zero. He wasn't one of those people. He wasn't one of those authors. There's not a shred of evidence he was influenced by industry, that he had, NIH grants when NIH grants were just rolling out. Very, very poorly funded studies, but he got it all done. And he had, 18 international collaborators. So you'd have to say everybody was in the take, which isn't true. And he didn't have cherry pick data. You're wrong. There was never a 6-country study. There was always 22 countries, but the data was so poor quality that he reported.
Well, I think that's the point, though. That's the point, is that he didn't show the data from all of the countries. And so whether I'm right or wrong, that's just what happens.
Yeah, but when you have a country that doesn't have death certificates like Mexico, so you're showing shit data. He chose not to show shit data. But let me just say, that was a paper in 1953. There was a hypothetical proposal. Then he did the science and published the science in 1970 prospectively. So it's the most abused. Please don't repeat it. Please don't show your ignorance. Don't say he cherry picked.
Well, so why I'm bringing it up is because of the fact, not that I believe it, it's that it's widely believed. And so what I'm asking,
I will say
what I'm asking for you to do is to clarify for people who might be misinterpreting it. And that's hopefully what we're doing here. But to your point, it's been widely discussed, and that is a lot of why people believe what they believe. So you're saying it's not true.
But, perpetuating stupidity of others is not a game I play. His Wikipedia before 2019 was completely wrong, but horrible. I wrote a lot of papers about him, and it's been completely rewritten and much more accurate in terms of, people have biases, and it's easy to go on Wikipedia and other sites like that. But when you really dive into the research, he studied 7 countries and 16 communities with 12,000 men. It got published with 18 co-authors in 1970, and it's authentic data. So if you hear people talking about he cherry-picked 6 countries, you really should scratch your head and probably listen to nothing else that they say. I mean, you really should, because you just shut them off. I mean, everybody has a bias, so it's easy to criticize dead people. Not a lot of people criticized Ancel Keys when he was alive, and he made it to 100.5.
And Dr. Ovadia, how do you feel about that? Because I know that's a big fundamental difference between the two.
Well, yeah,
belief systems, let's say.
And what I would say is that science evolves, and I think we now have ample evidence subsequent to Dr. Keys's work showing that saturated fat is not problematic, and there have been multiple studies, and even the American Heart Association has removed their limitations on saturated fat from their dietary intervention, from their dietary recommendations. So we need to acknowledge that science evolves. I am troubled by our current environment, where the vast majority of our studies around nutrition and heart disease are funded either by pharmaceutical companies or the food industry, and where our leading societies like the American Heart Association are largely supported by the pharmaceutical and the food industries. And I think that's a huge conflict of interest that we need to acknowledge, and we need to demand better. And so I like Dr. Kahn said, I'm not interested in attacking dead people. I would attack our current leadership in the medical community and look at the huge conflicts of interest within an organization like the American Heart Association, within the nutritional schools like the Harvard School of public health and Tufts and, someone like Dr. Mosafarian who, has taken large grants from the food industry, and to have them as the ones that are setting our policy around food, I think is very problematic. And it's, something that we need to face as a society.
Yeah, I bring it up because I think it's so foundational to how people perceive of the information they're getting from the doctor they're speaking with. There are people who believe through and through that Ancel Keys and others have influenced the data. And then there are people who believe through and through that that's completely false, right? And so to have some clarity on that, I think is important for people so they can understand, what, because that is what foundationally the science of today is built off of, whether we like it or not. So having that clarity is important. But I think we're pretty much at time. Is there anything else that you guys would like to add here in closing statements? Let's say we'll give it, each person gets 2 minutes to wrap things up, whether you want to touch on a little bit more saturated fat or anything else that you feel we missed, insulin resistant topics that we missed there. But go ahead, Dr. Ovadia, you can go first.
Yeah, well, first of all, I just want to thank Dr. Kahn because he is willing to engage in these discussions, and so many of our colleagues aren't. Whether they're invested in the plant-based world or the cholesterol-centric cardiology world, they're not even willing to engage in these discussions. And we need to acknowledge that science evolves. I'm sure Dr. Kahn, just like me, heard, the quip many times in medical school that half of what you learn in medical school is going to be proven to be wrong. We just don't know which half. And I believe it's incumbent on us as physicians to have open minds and to be willing to admit when, mistakes are made, when historical concepts are proven to be wrong. And that is how we do best by our patients. But ultimately, like I said, I'm interested in empowering patients. I want to work with people who want to, take back control of their health, take an active role in their health, and do those deep dives that we referred to figure out what the patient in front of us needs, not what, these guidelines might, blindly say that should be applied to everyone, when clearly that is not a good approach.
Awesome. Thank you. And Dr. Kahn, please, as well, anything you'd like to end with?
Yeah, I'd also like to thank my colleague. I was reading his bio, and we both went to accelerated pre-med medical school programs. I went in Ann Arbor, and you went in Pennsylvania?
Yep.
Is that right? Yeah, so we were both baby doctors, which is
Yep.
Penn State. That's what I thought. Kind of fun. And again, I engage in. I've been with Sean Baker and Paul Saladino and Dave Feldman and the others. I go on these podcasts because we do share that common thread of challenging medicine, emphasizing lifestyle, expanding the horizons, using new technology, and questioning. And we may have different approaches in nutrition. We probably have similar approaches on imaging and lab analysis, and probably the role of exercise and sleep and all the rest. So it was a good conversation, a little lively at times, which I think is how it should be. And this is an old tradition. I mean, Dean Ornish used to debate Dr. Atkins on national TV, in the old days when there wasn't the internet. So I'm glad you're keeping the tradition alive.
Absolutely. I want to say, you guys, that it's a lost art, as sad as that is, to have a long form communication. And I think it's the most important thing that we can have today, particularly with echo chambers. I have no interest in being one of those. I look for truth to identify what that is. And you guys, being the experts, can help figure out what that is for society and help us get a little bit closer. So I commend both of you guys for coming on, and I brought you both on for a reason. You're both experts in your field. So I do think that ending on what we agree on is the most important. And I think that is, we need to get rid of processed foods for
Amen.
first and foremost, right? Just get them all out. That's the number one thing. But you know, from there, and processed foods, it's going to look like most everything we have in the grocery stores and the gas stations. So basically go on the fringes and find yourself some good whole actual food. But like I said, you guys, really appreciate your time. Anything you guys send me or you reference, I'll attach below. And otherwise, we'll talk soon.